Doctor, let's start with the basics. What does exactly mean bone marrow transplant?
Hello everyone. Thank you for having me again in this podcast. And in this time, we will be discussing bone marrow transplant. Now, bone marrow transplant is one of the most common topics being discussed by various doctors throughout India. We have been practicing hematology and performing transplants since last 20 years. I have seen a sea change in bone marrow transplant, what it was, now what it is. Still, we have to go a very long way in getting the perfect solution to a disease via bone marrow transplant. Now, there are different types of bone marrow transplant. You must understand. There are two mainly: autologous bone marrow transplant and allogeneic bone marrow transplant. Autologous means where the patient's own stem cells are being harvested and reused or retransfused to the patient. Then it is called autologous bone marrow transplant. The conditions in which we do autologous bone marrow transplant is multiple myeloma, relapsed Hodgkin's and non-Hodgkin's lymphoma, relapsed APML, neuroblastoma, to name the few. So the patient's own stem cells are taken. So what we do is bring the disease under control by giving chemotherapy. Once we say the disease is under control by different tests or PET scan or bone marrow test, and then we harvest these stem cells from patient's own body. So patient is being subjected to some injections, filgrastim for 4 days, and the 5th day it is harvested by blood bank, by a machine, and it generally takes 3 to 4 hours. No harm done. It's very simple processes. The catheter has to be inserted and or cannula. Blood flows out through the catheter and it goes into the machine. It spins, takes out the stem cells in a different bag, return the rest of the blood inside the body. And it's an ongoing process for 3-4 hours.